Hi, I'm Angie. I'm a nurse practitioner student. How are you today?
Good, how are you?
I'm good. Can you verify your first and last name and date of birth for me?
Catherine Spangler, October 15th, 2001.
Okay, awesome. Do I have your consent to film this video?
Yes.
Awesome. Okay. I have washed my hands, performed hand hygiene. I'm providing patient privacy. I'm just going to be doing an abdominal assessment and then a musculoskeletal assessment and then a neuro assessment. Sound good?
Yes.
All right, so first things first, we're gonna do her abdominal assessment. So I'm just going to pull your shirt up and kind of just look at your belly. The color is tan. I have the gloves on, and I've washed my hands. Smooth texture throughout. There's no bruising, no excessive moisture. She doesn't have any scars or lesions or any nevi present. The contour is flat. She has some abdominal musculature. Her umbilicus is midline and inverted. There's no presence of Cullen sign. It's symmetrical all over, and peristalsis is present. Now I'm just going to listen for bruits over your abdominal arteries. So I'm going to start with the aortic artery, and I'm listening with the bell of my stethoscope. So listening to the aortic artery. Okay, no bruits present, or with the bell of the stethoscope, I'm sorry. Listening to the aortic artery, no bruits present. Now I'm going to just listen to her renal arteries, about right there. No bruits present. Good. And I'm just going to listen to her iliac arteries. Good. Good. And I'm just going to listen to her femoral arteries. Okay. No bruits present. And now I'm going to listen to your bowel sounds. So I'm going to start in her lower left quadrant. I'm going to start by listening with the bell of the stethoscope first. So start in the lower left quadrant. Okay, normal active. Going to the right lower. Normal active. Right upper. Normal active. And left upper. Okay, bowel sounds are normal active in all four quadrants. Now I'm just going to percuss all over. Any pain?
No.
Okay, good. All right, she has symphony heard all in her abdominal area, and then over her organs she has dullness, so that is good. She has her liver in the right upper quadrant and her spleen in the left upper quadrant. So now I'm just going to percuss over the liver some more. Okay, dullness, spleen, dullness. Okay, and then I'm going to palpate the abdomen using light palpation. So I'm going to start in the left lower quadrant. So just tell me if you feel any pain. Light palpation is done with one hand. Sorry.
No pain.
No pain? No pain?
No pain. No pain.
No pain?
No pain.
Okay, good. Now I'm going to use deep palpation, and I'm going to palpate with both hands. Any pain?
No. No. No.
Pain. Okay, she doesn't have any masses or tenderness. No guarding was present. No rebound tenderness was felt either. And the spleen was not felt at all. Now I'm just going to perform the liver scratch test. So with this, I'm going to kind of just put my diaphragm over where I think her liver may be located, and then I am going to literally just scratch. So I think, yeah, the liver's about right there. So I'm just going to scratch. Sorry. Okay, so based on sounds, her liver is normal size. So now I'm going to just do some special tests. So I'm going to start with Murphy's sign. This is just checking for gallbladder enlargement, cholecystitis. So what I'm going to do is I'm going to hook my hands around your liver, or not your liver, I'm sorry, your right rib cage. And if you just take a deep breath for me. Any pain?
No.
Okay, so her gallbladder is not inflamed. Okay, and then I'm going to do test for Pezzoa's sign. So this is just checking for appendix inflammation. So if you could just lie on your left side. Any inflammation?
No.
Okay. I'm just gonna have you raise this leg, and I'm gonna flex your knee, and I'm gonna internally rotate. Is there any pain?
No.
Okay. That is the obturator muscle test. So no negative for appendix inflammation. Okay, so then I'm going to go on to McBurney's point, or McBurney's test. And this is just checking for rebound tenderness. So what I'm going to do is I'm going to push on your belly button. And then I'm going to go to the crest of the hip and then kind of just meet in the middle. And then I'm just going to push on that middle point. And then when I let go, if there's any rebound tenderness felt, none?
No.
Okay, so then appendix inflammation is not present. Okay, so that's everything for abdominal. You can just sit back up, and now we're going to do a musculoskeletal assessment. So we're just gonna kind of do some special tests and stretch out your, test out your strength and everything. So as I'm going through, I'll inspect her joints and I'll kind of just verbalize the color and if there's anything out of alignment or whatever. So just looking at her, I don't see any muscle deformities, no edema. Anyway, yeah. So if you just remove your shoes and socks for me, please. I have to test your capillary refill in your upper and lower extremities. Okay, so can I see your hands? All right, so I'm just gonna test your cap refill. Okay. All right, I'm just gonna do your toes. All right. All right, so her capillary refill was less than 3 seconds in all extremities. That's really good. It means your blood's flowing all over. So now I'm just going to palpate your pulses. So I'm feeling your radial pulse. Okay, pulse is present. It's +2. Pulse present, +2. And then I gotta go in her brachial artery. I'm sorry. Okay, pulse present, +2. Okay, pulse present, +2. All right, then I'm gonna look at her dorsalis pedis pulse. Okay, +2, +2, and tibialis posterior, +2, and +2. All right, that's great. So now I'm going to just test your range of motion. So I'll start with your neck. So if you could just look up for me. Good. Look all the way back, hyperextend your neck, and then look down for me, flex it, and then laterally kind of bend it. Laterally bend it to the other side, and if you can just rotate. Okay, so range of motion is 5. It's good. So then now I'm going to look at your shoulders. So if you could just flex, and if you just abduct, and you can do both. We can actually do both at the same time. So you can just abduct and then adduct, and then if you could just flex And then if you could do internal rotation, external rotation. Okay, and then if you could just extend, hyperextend that way. Okay, good. So now I'm going to look at your, I'm going to have you perform the Apley scratch test. So if you can just kind of go like that. Okay, good. Any pain?
No.
No, okay. So range of motion is present there as well. So now I'm going to look at your elbow. So can you flex your elbow, extend your elbow, and then if you could just supinate, so go like that, and then pronate, go like that. Okay, so awesome. Range of motion present. So now I'm going to look at your wrist. So if you can just flex your wrist, extend your wrist, hyperextend it, yeah. And if you can do rotation, good. Okay, so now I'm gonna look at your fingers. So can you flex your fingers, extend your fingers, adduct your fingers, abduct your fingers. And you can see that her snuff box is visible. Okay, so now can I have you lay back? I gotta have you do some hip rotating. Okay, so if you could just external rotation for your hip, and if you do both legs for me, that's good. So you can see that she has external and internal rotation present, so her range of motion in her hip is good. And if you can just abduct your right leg, so if you can just kind of extend it and then kind of this way. Okay, good. So she has abduction, or adduction and abduction is present. And then if you can just go this way and then that way, so that's present as well. So now I'm just going to look at your knee. So is there a way you can kind of like scoot back a little bit? I don't want you to just be hanging off the... Okay, so there we go. So you can see that she has flexion in her knee. Can you extend it? Good. Okay, good. Now I gotta look at this one. Good, good. Okay, now I'm going to have it, you flex on 99 degree, and then she can kind of go abduction. Adduction is present. And then same with this one, abduction, adduction is present. Okay, you can sit up now. Okay, so moving right along. So now we're going to test her range of motion in her ankles. So I'm going, if you can just, you can do this both at the same time. So if you can just do flexion and then kind of bring your toes up and then extend them. And then can you turn them out to the sides? Can you rotate them? Sorry, I'm touching all over your feet. Okay, so range of motion is present in her ankle. So now I'm just going to, if you could just stand up for me, I'm going to look at your range of motion in your spine. So if you can just flex, bend over, and then extend, hyperextend. You don't have to bend all the way backwards. So then if you can just kind of bend at your sides, bend at your sides. Okay, and can you go like that and like that? All right, good. So range of motion present. Now I'm just going to look at her spine. So you can come here. And we're gonna assess for scoliosis. So if I can just pull your shirt up. Good. Can you just bend over for me? Okay. She doesn't have scoliosis. So awkward. Here. You can sit down. All right. So now I'm gonna test your muscle strength. So I have washed my hands and I was just touching her feet and everything. So now I'm going to test muscular strength in your neck. So, all right, so now I'm just going to test muscle strength in your neck. So when I'm just going to have you kind of flex your head. So go like this and then just press against me. Okay, it's present. So now I'm gonna have you extend your neck and just press back against me. I'm just gonna resist me. Okay. So then, if you can just turn this way, I'm gonna press against you. Good. Awesome. Really strong. So other way. Yep. Okay. She has 5 for muscle strength. So good. Now I'm going to test muscle strength in your shoulders. So I'm gonna take your arm and then I'm going to, if you could just abduct it, and then I'm going to push against you. Okay, so ready? Yep. And then I'm going to now adduct for in that. Good. Okay. So same with this one. So try to abduct it. Good. And then try to adduct. Yeah. Good. You're just saying me. So then I'm moving on to your elbows now. So yes. Yeah, flex your elbows for me. So just fight me. Okay, so now I'm just going to test strength in your elbow. So I'm gonna first do your bicep. So if you can just try to flex like that. Yep, good. Now I'm gonna do the other arm and do the same thing. Good. And now we're just gonna do extension in your elbow. So just try to extend it now and just resist me. Other one. Good. Okay, so then we're gonna go into your hands. So if you can just squeeze my hands, squeeze them hard. Good. So good. Strength is 5 plus 5 in there, in your hands, everywhere else as well. So then we're going to move into your knees. So have your knees flexed, and if you could just extend them, good, and then flex them, good. So while she was extending them, I was pulling against her force, and then same with flexion. So do the same one. So she's gonna extend, and I'm just gonna push, and then she's gonna flex, and I'm just gonna pull. Okay, so good. Plus 5 for muscle strength in her knees. So then I'm going to do plantar flexion and dorsiflexion in her ankles to test her muscle strength there. So if you can just push up against me. Okay, good. And then I'm gonna go underneath your toes and then just push down. Okay, so plantar flexion and dorsiflexion in her ankles is a 5, so we're good. Now I'm going to do some specialty tests. So we're gonna start with the straight leg test. I'm gonna have you just lay flat down on your back, and then I'm going to bring your leg to 90-90, and then I'm really just gonna make your leg go straight, basically, and then I'm going to have you, if you just, does that hurt at all? No? Okay, so she doesn't have any. This test is for nerve root compression, so she had no pain, so it's negative for that. Sorry. And then I'm going to do the same thing, so I'm going to have her 90-90, and then I'm just going to extend her leg and then flex. Any pain? So negative for nerve root compression. With the straight leg test, so then I'm going to do the ballottement test, and this just tests for intercapsule swelling of the knee. So what I'm going to do, could you kind of like lay back? Well, no, this will be okay. This will be okay. So I'm going to place one hand above and below the patella. I'm going to put my index finger here. And does that hurt when I push? No. Okay. I'm pushing on her patella, and there's no intercapsule swelling there. So I'm just going to do the same one with that. I'm going to push it together and then slide my index finger right here and push. Any pain? No. Okay, and it's not swollen or anything, so it's also negative for intercapsular swelling there as well. So now I'm just going to do the bulge test. So that is, we're gonna feel for like a fluid shift. So I'll take her leg, and on the medial side of her knee, I will swipe down, and on the lateral side, or I'll swipe up, and then on the lateral side, I'll swipe down. and I did not feel a fluid shift there. So there is no swelling or in there. And I'm going to do the same with her left leg. So here we go. Any pain or anything?
No.
Okay, and no fluid shift was felt there. So now I'm going to the McMurray exam, and that is just testing for meniscal tears. So I need you to kind of scoot back for me. It's kind of weird, sorry. Yeah, and if you could just kind of put your feet on the edge of the table. Sorry. So for this, I'm gonna put my I'm going to put my middle finger on the medial joint line, and then I'm gonna have my thumb on the lateral one. So again, we're just doing the McMurray test. So I'm gonna have your leg at 90-90. I'm going to just place my hands like that. So I'm going to flex and extend while internally and externally rotating this knee. Okay, any pain? No? Okay, good. So I'm gonna do the same with the other one. So I'm gonna flex and have her extend. And I'm gonna internally and externally rotate. Any pain or anything? No? Okay, good. So there's no indication of meniscal tears with McMurray's exam. So I'm going to do the anterior and posterior drawer test. So is there any way you can possibly scoot that a little bit more? If not, it's okay. So now I'm really just going to sit on your feet. And this is looking for ACL and PCL tears. So I'm going to, I'm sitting on your foot. I'm just going to grab your knee, and with my thumb on top of the patella, I'm going to pull forward. Any pain or anything? No. Okay, good. So her ACL is not torn because her tibia did not slide forward, and it did not slide backwards either. So her PCL is not torn either. Okay, you can scoot back up now. Sorry. So now we're going to do the Lachman test, and that's for your ACL and PCL as well. So I'm just going to have you extend your legs out, and I'm going to put my thumbs below and above your patella. So I'm just going to pull forward and push backwards. Any pain? No? Okay, good. So now I'm going to do the valgus and varus. So the valgus test for the MCL and the varus test for the LCL. And for this one, you can just kind of fully extend. Okay, so yeah. I'm just gonna do one leg at this time. Okay, so I'm going to place the palm of my hand on her lateral joint line, and I'm just going to push. Any pain? No, okay. And then I'm gonna do the same with this one. Good. Nice. Okay. So I did that at 0 degrees, and I'm gonna do this at like 30 degrees, so that'd be like right there. So just kind of support on me. Okay. So I'm just gonna push. Any pain? No. Okay. I'll do the same with this one. Okay. So lateral push. Pain? No. Okay. Awesome. So valgus and varus were negative. So now you can sit back up. I'm sorry you're laying on this tiny examination table for so long. So now I'm just going to do the Tunnel and Fallon test. So this is just testing for carpal tunnel syndrome. So you can just, you're supposed to place it on a table, but you can just place your hand on me. And I'm just literally going to tap for like 30 seconds. It's been 30 seconds. Any numbness? Tingling? No. Okay, good. So Tunnel's is negative. And this is my table. I'm just making do. Okay, so tapping. Any numbness or tingling? No. Okay, good. So negative Tunnel test in her hands. This is testing for carpal tunnel. So then I'm going to do the Fallon test. So I can just have you hold the dorsums of your hands together. So any pain or tenderness? All right, so there's no indication of carpal tunnel, no median nerve root impingement, so good there. Now moving on to the next special test, that's the Finkelstein's exam. It's looking for dequiverin, so if you can just pretend, this is a table, and just put your hand on me, and you just make a fist. Is there any pain?
No.
Okay, now put your thumb in here. Any pain?
No.
Okay, good. So do the same thing with that one. So make a fist. Any pain? I'll make a fist there. Any pain?
No.
Okay, so negative Finkelstein signs, so she's not have dequiverins. And now I'm going to do the Sperling's test. So I'm just going to come behind you, and this is just. So I'm just gonna have you. Can you look up at the ceiling for me? Okay, so can you, while you're looking up at the ceiling, can you kind of make your ear touch your, good, and then do the other side, good. Okay, so go back to the right side. I'm just gonna kind of press down. Any pain?
No.
Okay, so she doesn't have any nerve root lesions. So I'm gonna do the other side. Any pain?
No.
No? Okay. Good, good, good. So next, after the Sperlings, we have Hawkins. So if you could just flex your shoulder and then internally rotate, externally rotate, and then flex shoulder 90 degrees, internally rotate, okay. And then I'm gonna do the same thing here. Internally, and then, sorry, like this. And then turn in, turn out. Okay, is there any pain? So she doesn't have any impingements or anything. Then last we're gonna do the drop arm and empty can. So if you can just, you can stand up. So if you can just place your hands at your side like this, and then hold your, go like this, and then have it kind of like this. So can you hold this for, yeah, she's holding it for 30 seconds, so we're good. And then just kind of empty the can, and then I see that internal rotation is present, and one arm is not lower than the other one, so we are not injured there, and that's everything for musculoskeletal. Okay, so that was everything for musculoskeletal. Now we're just gonna run through neuro, so you can have a seat for me. Okay, do you know what year it is?
2023.
Do you know who the president is?
Joe Biden.
Okay, good. Her mood and affects is her situation. Her cognition is present. So I'm just gonna name off some fruit. If you could just tell me which one's yellow. So apple, orange, banana, pineapple. Okay, yeah, those are both yellow. So that's good. I mean, her judgment and abstraction is correct. So then we're going to go into the, now we're going to test her judgment. So let's say that you found $100 laying on the side of the road. Would you keep it for yourself, or would you try to go and figure out who it belongs to?
Figure out who it belongs to.
So her judgment is intact. Okay, so now I'm just going to go through your deep tendon reflexes. So I'm going to start with your upper extremity. So I'm going to test her, the reflex in her tricep. So present. And then I'm going to, you can have it back down. So then I'm just going to tap. Good. Her reflex is 2 months. And then I'm going to test your brachioradialis. So, okay, 2 months. Alright, and then I'm going to do the same thing in this arm. Okay, let's get my finger. Okay. So I'm just going to tap. We're good here. 2 plus, and then we're gonna do it in her bicep, so just good. And her brachioradialis. Good, 2 plus. Okay, so now we're gonna go to your lower extremities, and I'm just gonna check your patellar reflex. So good, and then we're gonna go to her right Achilles. So good. Okay, then we're gonna check the other leg. Good, and we're gonna do this Achilles. Good. Okay, so then if you just kind of face the camera a little bit, I'm going to check for the Babinski reflex. Okay, so I'm gonna grab your foot, sorry. We're gonna start at the ball of the foot, and I'm just gonna go up and then out, and then as you can see, it is present, it goes upwards. So let's do this other side as well. Okay, start at the bottom, go upward, and then in. Good, so it is down going for the Babinski. Remember, normal for peds is down going up until 2 years old. So then I'm going to look at clonus. So I'm just gonna have you relax your foot, and then relax it, and then I'm just gonna pop it up. Okay, and I don't feel any clicking or anything, so there's no muscle strain there. And then I'm gonna do the other one. So just relax that foot, click up, and no clicking, so we're good there. Okay, so then I'm going to test her sensory and cerebellar function. So with my tuning fork, this is my tuning fork. It was also my tool to assess her reflexes, but this is also my tuning fork. So I'm going to bang it, and I'm just gonna hold it to some bony prominence. So bang, and then I'm placing it there. And then I'm gonna place it on this one. Does it feel the same?
Yes.
Good, okay. So that is good. So then I'm gonna do the same thing with your toes. So I'm gonna bang my tuning fork, place it on my bony prominent. And then, do you feel it?
Yes.
Okay. I'm gonna do the same thing right here. You feel that?
Yes.
Okay, so that's good. So then we want to do the toe and the hand. So you feel that?
Yes.
You feel that?
Yes.
And it's the same?
Yes.
Okay, nice. So then I'm going to do the light touch and pinprick. So I'm going to just prick you a little bit. So tell me if it's dull or sharp. So
Dull. Sharp. Dull. Sharp.
okay.
Dull. Sharp. Dull. Sharp.
And I'm gonna do the same in her lower extremity. So
Dull. Sharp. Dull. Sharp.
okay, we're good there. So then we're going to go into stereognosis. So I'm just gonna have you close your eyes and place an object in your hand. You can't look at it, and you just tell me what it is. So can you open up your right hand for me? What is that?
A ball.
Yes. Okay, keep your eyes closed. I'm gonna go on the other hand. Can you open up your left hand? What is that?
Tape.
Yes. That's correct. Okay, so then I'm going to test graphesthesia. So I'm basically just going to, if you can just close your eyes, I'm going to draw a figure on your palm, and you just tell me what it is. Okay, so
A heart.
yes.
A heart.
Yes, that's right. Okay, so now we're going to do the 2-point discrimination. So I'm just gonna take 2 pointy objects. I'm just gonna use my nails, but I would actually use a sharper object in practice. So when you feel 2 points, just hold. Okay. So I'm gonna do it on your arm. So I'm gonna start close, and then when you start feeling 2 points, just let me know.
2 points.
Okay, good. Now I'm gonna do the other arm.
2 points.
Good, good. Okay. So then we're going to do the serial finger opposition. So I'm just gonna have you touch the tips of your fingers like this. Yeah. Good, good. And then if you can just do the nose to finger, just good. And then I'm gonna have you do the alternating rapid hand patting. Okay, and we're good there. So cerebral function is good there, and then I'm going to have you. Can you stand up for me? I'm going to test Pronator and Romberg together. So I'm just going to have you lay your arm or have your arms out in front of you like this, and can you just close your eyes? And you're supposed to hold it for like 30 seconds, a minute. And can you have your palms up? Sorry. Okay, so I don't see any tremors or anything like that. I held it for a minute, or she held it for a minute, so positive there, or negative there, I'm sorry. So then can I just have you do the another test? It's the heel to shin test. So just take your heel and just kind of like run it down your shin. Just like that, yeah, good. Okay, very good. So then I have to do a foot tapping test. So if you could just tap your foot. Good, good, good. Do the other one. Yeah, and it's the same in both feet, so that's equal, so that's good. And then I need to look at your walking. So if you could just kind of step right back here. And then just walk towards me. I'm just gonna observe your gait, and it's symmetrical, and her arms are swinging. And we're good. Okay, so you can come back. Can you just walk on your tippy toes for me? Good. Can you walk on your heels for me? Good, good, good. So then I'm going to do the tandem walking test. So you just kind of, it's like you were pulled over and they're trying to see if you were drinking. So just, yeah, we're good there. So her balance is all intact and cerebral function is good. So that completes everything.